This is a video in a patient where we performed a pseudoaneurysm manual compression hold, and overnight it did not work. So we elected instead to inject it with thrombin, and now I am going to show you guys how I like to mark pulses once we have finished the procedure, or in any vascular patient, in fact. This is how we should mark pulses and monitor them on the floor. So if you're a nurse on a vascular floor, I'm going to show you now how I like to do it. So first of all, I get myself in a comfortable position, make sure that I'm not having any back pain, and I use the fingertips of my finger. I kind of close my eyes and I sort of become mindful, try to meditate a bit, try to just really spend 10 to 15 seconds on each spot, really trying to feel that pulse. And for the dorsalis pedis, the DP, if you flex, if you push the big toe upward, you can actually see the tendon, and you just go towards the little toe, the lateral aspect of that tendon, and usually you can find the pulse there. But you have to spend quite a bit of time there, especially if you're new, really just trying to feel it. And I would encourage every new nurse to practice doing this. So it's right there on that right there lateral to that tendon usually. And I feel just starting where the ankle turns and falling a little bit. Then for the posterior tibial, I go from the opposite side. I never go from the same side as where the vessel is. So I go from the other side of the leg. So I'm standing on the patient's little toe side and curling either my right hand or left hand over and trying to push the blood vessel up against the bone. Once I find the pulses, I mark it and with a pen, and I say palpable, not just an X, but actually palpable, 2 plus, 1 plus, so that the following day, we don't have to look for a Doppler because we know it's palpable, or we always know that a Doppler is needed.